still fresh. It's a Tuesday, and of course, every Tuesday we come here to discuss health. And here we are today with our Tuesday edition of the Family Hour. Edrine Mukalazi is my name, and today we are discussing something very, very important. That is something to do with our oral health. Of course, we know that if you have issues in your mouth, then you'll lose peace. You'll not smile as you should have. There are moments where you have to laugh while covering your mouth. I mean, you cannot whisper to someone because there is a lot. Now, today, the remedy is here. We are looking at oral hygiene instructions, and with us is Dr. Ssemwogerere Anorld, who is a dental surgeon from Tafik International Hospital. Doctor, a good evening. It's a pleasure having you with us this evening.
Good evening, Mr. Edrine.
We are delighted to have you discussing this very pertinent topic. But before we get into the details of the topic, I request you to greet our viewer out there who is watching us this evening.
Good evening, everyone who is at Family TV. I'm Arnold, Dr. Arnold Ssemwogerere, working at Tafik International Hospital as a dental surgeon. And briefly, I've come here to brief everyone about dental health in general.
Okay, so talking about dental health, and of course, talking about oral health hygiene, someone would really want to understand what this really means. Can you help us break it down, especially for someone who is not into dentistry, someone who is a layman like me, wanting to understand what we are talking about and the message?
Yeah. So oral hygiene instructions. These are measures that a person takes every day to take care of their oral health. Oral health, I mean what is contained in our mouth. Because if you look at our mouth, we do not only have the teeth. We have the gum, we have the tongue, and it's a special area because anything that we take into our body has to pass here. Yeah, it's a direct communication to our body. Because from the start of it to the end of it, it's a continuation, just a continuation to our stomach, to the intestines. So we need to be mindful of how to clean it so that we have a proper, clean structure.
When you talk about oral, what runs to our mind is only the teeth, and you'll find we spend a lot of time on the teeth, forgetting about the other organs that you're just mentioning. Maybe just to tell us all those organs that are embedded into the oral cavity.
So, as I've mentioned earlier, we have the teeth themselves. Everyone knows that.
The commonest.
Yeah. So we have the lips, even though it's outside. Yeah. So we need to take good care of our lips because you've seen accidents. Yeah. People normally get accidents on the borders, on the roads, sports activities, even in our daily life because they're exposed. We have the gum. Obviously, it's a soft tissue that embeds the bone that is holding our teeth in a proper position to give it firm strength because we need them to be firm as we are eating. Yeah. We have the tongue lastly. And after the tongue, sorry about that, we have a floor that is down and something that is on the roof which is called a palate. They're all structures that we have in our mouth.
Okay. Now, and of course, when you talk about all this, they're equally important because when you talk about the lips, when you talk about the tongue, when you talk about the teeth, when you talk about the gums, they all are important. But from what you've just mentioned, I believe someone should be wondering and asking why oral health instructions are really very important.
Yeah. I normally in my practice, I get that a lot. I get patients that come in, they have a cavity and they're complaining, but doctor, I'm always brushing. Why do I have cavities? but Dr. Amore is doing this and this. Why do I have what? A painful tooth. So the first importance of oral hygiene instructions is to prevent oral diseases, because we have so many diseases that we can acquire in our mouth. The commonest disease being tooth decay. Tooth decay, actually, after flu, tooth decay is almost entirely in everyone. And it keeps on developing because our teeth, the first layer has no sensation. So no one can feel pain until maybe things are worse. Maybe they have developed a cavity. Maybe that decay has reached into the sensitive parts that are embedded down in the tooth. So it stimulates that sensitivity, and that's when they come to us.
And so some people have even learned to live with it. They even know which painkillers they take each time they get the sensation.
Yeah. I've also encountered that a lot. But to my advice, if you encounter any oral health problem, you should see your dentist. If you don't have one, I'm here. Okay. So the second point on why we should have oral hygiene instructions, right, is actually the point I mentioned earlier, because it's a direct communication to our system. If you look at where your mouth ends, there is no stop, or there isn't any filter that filters anything that you've eaten to proceed down to your stomach. So if you keep your structures or tissues that are located in your mouth in a proper, healthy way, you will avoid diseases that can be taken into the system, because we have had a number of that, ulcers being one of them. We have inflammation of linings of tissues, because when you look at the intestines, they have linings. The stomach, it also has a lining, so we can carry bad bacteria that is in our mouth, which we have acquired by not taking good care of our oral health. So if we carry those bad bacteria or microorganisms with the food down, they can cause us problems. Thirdly, we have patients that have already developed these diseases. So oral hygiene instructions are helpful to control the spread or the circulation of, you have patients that have tooth decay already, and it's bound to happen, and it keeps on continuing. So the only way to stop that encounter is having your proper instructions being done right.
Okay. When we talk about instructions, any other importance before? I don't want to divert you.
No, it's okay.
Yeah, because when you talk about instructions, someone will now ask, what are these instructions they're talking about? But before we get into a breakdown of these instructions, I would also need to know what they need, the instruments they need, or the materials they need to in effecting oral health instructions.
Actually, we have a couple of items that have importance in our oral cleaning. Okay. The commonest being obviously toothpaste. Everyone knows toothpaste. But the toothpaste we have to use has to contain a chemical called fluoride. Okay. Fluoride helps us to stop tooth decay. We have a toothbrush. Everyone knows.
It's still about the toothpaste. Of course, the number of brands and colors, and then you find this one has this and this and this. So what should someone look out for besides looking for one that has fluoride? What should someone look out for when they're choosing a toothpaste?
Now, okay, that depends on what someone wants to achieve. For example, we have people that come in complaining of sensitivity. We prescribe to them a particular toothpaste. We have people coming and complaining about having a lot of decay. there is a particular toothpaste we recommend for that. We have people that have gum disease. Have you heard of gum disease before? People that have bleeding gums. This is a disease that can be caused when you have bad bacteria that has if affected your gums. They cause them to bleed, to inflame and bleed. So we have, but not particularly toothpaste, but we have other remedies that we prescribe for them to use. So it depends. It's not particularly one brand or one type of toothpaste.
So some people think that the more expensive a toothpaste is the more effective.
No, it's actually not that. It depends on what case you're presenting as a person. That's why it's important not to diagnose yourself, get in contact with your dentist, and seek out the best possible solution.
So, doctor, does this mean that even while choosing a toothpaste, I still have to consult a dentist?
I think that is the best idea.
Okay.
Yeah. To prevent all the things that we have been talking about. Yeah. So to continue with the items that we need for cleaning, I stopped on toothpaste.
Yes.
We have mouthwash. This can be used also depending on someone's case. We have things like
can a mouthwash work in the place of a toothpaste, or I can use both concurrently?
No, it depends, but me personally, I would not substitute it with a what? With a toothpaste, because a mouthwash, using it on a daily basis or for a long time also has effects. It contains a lot of chemicals, and we normally prescribe it to people when there is need. I've given you an example. When someone has gum disease, we use it to control the levels of bad bacteria that are in the mouth. Someone has gotten an accident, they have wounds in their mouth. They need, first of all, to provide that relief. We give them painkillers, we provide mouthwash, it provides relief, and also it sets like an environment, a conducive environment for those wounds to heal. So this is all dependent on what your dentist has suggested after the examination. Okay. So the other item is we have something we call an interdental brush.
That sounds like a little new.
Yeah, it's like a stick, but it has filaments all around it, in rotating around like in a 360 way. So this brush, I know it's new to you, but we provide it to people that have opted to go for the orthodontics. You've seen people that have braces before, so they cannot use a normal toothbrush very well. So we suggest this because it's convenient for them to clean their mouth as they take on their treatment procedure. The other item we can use to clean our tissues that are inside our mouth is we have a water floss. This blows water at a high speed in our mouth to clean our gums.
How does this look like?
Now I wish I had come with a picture of it and I present it to our viewers. It's like a sort of a gun, but it has a tube. So it is pressed on you feel it down here. There is a tank that contains water. So this tube up, it has a hole on top that blows water with high pressure. So we have areas where a toothbrush cannot reach it. So this, the tip of the water floss, it is curved, and it can reach in many areas of the mouth. So it can help us to clean those areas that cannot be cleaned with a toothbrush. Yeah.
Okay. Any other material?
We have a dental floss.
Okay.
A dental floss is a thread. Actually, it's something they substituted for a toothpick. Everyone knows a toothpick. We have grown up seeing our parents using a toothpick. And the disadvantages of using toothpicks is that they increase the space that we have in our teeth. Teeth move.
How does that happen? Because, I mean, up to now, we still have people who are locked in toothpicks that they go to a restaurant and they'll even ask, don't you provide toothpicks here?
No, it's the same concept that we provide that we suggest to patients that come in with crooked teeth. I've mentioned about braces earlier on. So when someone comes into our facility and they are not happy about how their teeth are shaped, they are crooked, they are not aligned well, this has affected their general appearance and it has lowered their self-esteem as people. So we use this concept of teeth moving. We have special wires that move them controllably. So that same concept can be applied here. So if you're a person that loves using toothpicks and you're constantly squeezing that wood into the spaces that are contained in between the teeth, first of all, they widen. And them being hard, they affect the soft tissue that is down, that is the gum. They make it to bleed. So those are two disadvantages. So with that, people opted to use a dental floss. I don't know if you've ever, you know it. It's a thread.
On a plastic stuff.
Exactly, yeah. So if you have anything stuck, maybe after a meal of meat or chicken, you have something that is heavily stuck in there, it's better you opt for a dental floss.
You talked about toothbrushes, and there's also some stories around toothbrushes. So which is the best toothbrush? You'll find someone saying use a soft one, then use a hard one. When do I use a hard one? When do I use a soft one? When do I use a flat toothbrush? And do I use one with curves? I mean, there is quite a lot of science there that someone would want to understand.
Actually, what you've said is true. Toothbrushes have types. There are 3 types. We have a soft toothbrush. We have medium hard, and we have a hard toothbrush. This hard toothbrush, it's not normally recommended by any dentist because it erodes. Our teeth, even if they're hard, they can lose their structure after vigorously being.
And some of us brush as if you're in a waffle.
You're not supposed to use energy when you're brushing. It's the technique that you're supposed to use. So we normally use the other 2, the soft one and the medium hard. So for the soft one, we recommend it for babies, people that have maybe like from 6 years, from 3 years to 6 years, and maybe up to like 8 years. So people that are clocking into adolescence, they can use medium hard. Even the adults themselves, it's better.
Okay. What about flat, then one with curves? Which is better, or whatever you use is better?
I've not encountered any physiology, any idea behind that. I think it's basically about the designs of the company, the producers of these toothbrushes. So they prefer to make different shapes to attract anyone who is going to use that brand or opt to buy that toothpaste. But the most important thing is the hardness of those bristles that you put to clean to clean your teeth.
Okay. The other concern is for how long should one use a toothbrush? Because there's someone who tells you use it for a month or 3 months. So I mean, and there's someone who uses it for a year. So for how long should someone use a toothbrush?
No. Okay, like it should be used for a period of like 6 months. After 6 months, you should get a new toothbrush because these are bristles. The white filaments, they're normally white in color. They tend to lose their fabric or the potential to clean the teeth very well. And sometimes even during the cleaning, they accumulate bad bacteria. So after some time, after 6 months, you normally have to change to a new one.
And how about the storage?
The storage. I think you need to keep your toothbrush in a clean place. There are trays that are designed actually to keep these toothbrushes in an isolated environment. Because remember, once you put it, some people prefer to put these toothbrushes with the rest of the things they use when they're bathing. Or this is wrong, because the water that is contained maybe in the things that we are using for bathing might spill onto the toothbrush, and it's the same toothbrush that you're going to engage into the mouth or onto your teeth, and it all takes us to the other point that I was talking about earlier on. Putting bad bacteria into our mouth.
Okay.
So it will cause gum disease, tooth decay, disrupt the oral environment, bring us problems of oral diseases. Actually, storage is also important. Make sure that you find a small case. I remember there are some brands that used to give us those cases where you would lock your toothbrush after using it. After using it, you clean it very well, you dry it, you make sure that you return it to that particular case and you seal it.
I wonder what happened to those brands. These days you have to buy it. I think the materials became so expensive. But before we get to the break, still in the same, can I use, for example, a dental floss? I use it today, I keep it, or I wash it. The economy is sometimes hard. So I want to use it for more than one time. I use it, I clean it. Maybe I rinse it in warm water, I keep it, I use it the next time. Is that advisable?
No, I wouldn't advise that, because actually the people that design dental flosses, one thing they put emphasis on is the economical part of it. Those things are cheap. The parts that you've used, you let out a string and you have to wrap it on one end. You always have to use this middle finger. You wrap it on your middle finger, then you hold it with a thumb, then wrap it on the other end. So you always have to squeeze it in between your teeth, and you make sure that it makes something like a circle, a C shape. So you move it up and down until your gum, because where the teeth ends and where the gum starts, there is a pocket. It's like sort of like a sleeve in here, and that is also another area where food accumulates, especially the food that is soft. The soft meals, they can enter in there. So you make sure that you clean inside, and after you've done that cleaning, you're supposed to dispose of that part of the floss that you've used, and you use a new one. When it ends, you have to buy another one because they're cheap.
Okay. Well, thank you so much. We are taking a short commercial break, and when we return, we'll continue with oral hygiene instructions. Stay with us. Welcome back from the break. This is a family hour. Today is a Tuesday, and because it's a Tuesday, we are here with our family health edition of the family hour, and we are looking at oral health instructions. Before the break, we had an inner depth of especially the toothpaste, the toothbrush, and all those details, but also why it is important for you to maintain your oral health. Now, of course, there are very many, doctor, there are very many theories surrounding brushing. Of course, we talked about the toothpaste and the toothbrush. Now, there are a lot of theories about brushing. When you brush, don't rinse the paste because it is called toothpaste, so you just paste it on the teeth. Someone will tell you brush, and then others will tell you spend about 3 minutes brushing, and then I imagine when you wake up, you're late for work, and I mean, when should you brush? They tell us after a meal. Now imagine in the morning, coming to office before you eat, and then you're supposed to interact with people before you brush. I mean, there is quite a lot that surrounds brushing. Kindly take us through brushing so that someone watching us can really know when they should brush and why they should brush their teeth.
Thank you so much again, Mr. Edrine. To answer your question, I've also encountered a lot of concerning questions from my patients about brushing, but I personally think that a normal person is supposed to brush twice in a day. That is in the morning when you wake up, and immediately before you go to bed. In the morning, because we all know what happens in the morning. We have spent our night when our mouth is closed. We have a lot of bacteria in there. Oftenly, most of us wake up with a bad breath. So we need to clean that area before we consume anything. So why at night is normally you spend the entire day eating. You cannot spend a day without eating. You eat breakfast, you eat lunch. Some people have meals in between breakfast and lunch. We have those that have meals in between supper and lunch, snacks in between, and then supper or dinner at night. So all the things that you've eaten are into the mouth, and you have to bear a fact that there are some foods that can not even be easily visible. For example, if you take tea that has sugar, that is food to me because it has sugar, but you will not see the sugar. You yourself, you cannot see it, maybe like a piece of meat that is stuck in between the teeth, but that sugar will stay on the teeth. Same to refined foods, yogurt, juices, and these things need to be cleaned off because when you leave them, they actually accelerate tooth decay. Remember, you're going to spend the entire night when your mouth is closed. This is even practical. If you leave for example, a plate of food on the table, and when it is covered in the morning, you find it when it's smelling. So the bacteria or the microorganisms that have been into that space have done their activity. They have made food to decay, and it's the same concept we have in the mouth. So if you sleep without cleaning your mouth, all that activity that is going to happen on the teeth that contain food will increase tooth decay. These bacteria, they will eat that food, release acids, because that's how teeth decays. Release acids that will actually make your teeth decay. So it's in the morning and in the evening. So the other thing I would put emphasis on is cleaning our teeth or cleaning our mouth. You should really seek instructions from your dentist because I've seen a lot of people that need adjustments. What do I mean by adjustments? If brushing, if they're brushing in the morning and in the evening, it will not be enough. You get what I mean? They're doing it, but it's still not enough because they're losing more teeth due to tooth decay. So there are other measures that we employ. For example, I mentioned about use of mouthwash, flossing. There are even other habits that we can take up. I normally recommend patients that have lost a lot of teeth due to tooth decay to always rinse their mouth after they have taken a meal. It's easy, and it also increases the effectiveness of the other methods if you employ them. Because if you've taken your meal and you get a glass of water, you rinse, you can spit out that water or you can swallow it. Either way, it works. It works. It does a lot of magic. So you're cleaning off the stains or the food that is remaining. Because we will find people that do not actually need all this. We'll find people that actually have never experienced any tooth decay, and the natural cleanser, which is saliva that is secreted in our mouth, is okay. There are people that have never experienced tooth decay in their life.
Those are blessed.
It's ironic, that's how ironic it is.
Then we have a category of people who use sticks. You find them using sticks in the morning, in the afternoon, in the evening. I mean, it's so much in some specific rural areas. But how effective is this?
I would not really recommend anyone to use sticks because they are not designed to effectively clean the teeth or the gums. So a toothbrush has been designed very well by a professional with those blisters that engage teeth and the gum that is next to the teeth to clean everything effectively. So the other thing I would put emphasis on is the technique that we need when you're brushing your teeth. You see, if you have a clear imagination of our teeth in the mouth, the front teeth actually have two surfaces. It's sort of, they're shaped like a hole. And the teeth behind this side, they are sort of shaped like a brick. They have three surfaces. So the front teeth, they have a surface that is close to the tongue inside. And they have a surface that is close to the lip. All these surfaces, they have to be engaged. Help me with your pen. I'll use this as a demonstration of a toothbrush. So you engage the surface that is inside, and you engage the surface that is outside. That is for the front teeth. The behind teeth, it's like a brick. We have a surface that is rough. It's actually rough to help the teeth to grind. It creates edges to grind the food that we are eating, to squeeze it, to make it soft. So you clean that surface. Because it's rough, it will retain food. Actually, this area here is very susceptible to tooth decay because of that element. Those ridges that are in there, you find some areas are raised, some it's like they have pits. Every person that is experiencing tooth decay, it has to start in this area most oftenly. So you have to clean this area very well. You have to clean the area close to your cheek, this side. You have to clean the area close to the tongue.
Isn't it really hard cleaning, especially the one close to the tongue?
No, it's not hard. You can squeeze in. You can squeeze in from this side, even this side. You will try when you go to your house. And there are areas that I've not even talked about. Because if you have a tooth here and another tooth here, we have space in between. So that can be cleaned with a floss, like I talked about. So you combine both, brushing and flossing.
And then, of course, what about the duration? Because someone would be so fast, they're late for work, and then they spend maybe 30 seconds or a minute, and then another will take their time. They even have a mirror. They will look into what they are doing. So how long should someone spend while doing all this?
So for effective work, someone should take a minimum of like 3 minutes.
Okay. Why 3 minutes?
Because I believe we have talked a lot about how you should brush those areas, and for you to effectively clean them, I believe within 3 minutes it can be done. 2 minutes it would be rush work.
Okay.
You would leave some areas that are untouched, and that's when you get problems for our important tissues that we always need to eat the food daily.
Okay. Now we've talked about, I think most of the discussion we've been talking about the teeth or the tooth, and yet you told us that there are other
tissues,
or organs or parts in the mouth. So how then do we maintain them healthy? The tongue, the jaws, the gums, the lips, and all those others.
The tongue has to be cleaned every day.
Okay.
Because the tongue, if you look at it very well, it's kind of rough, and there is a way it is active when we have eaten food, because it always has to chime the food. We call it turning. When you've put in the meat, you have to turn it. It's just a natural instinct that God put in us. When you've eaten the meat on one side, you have to turn it. You don't use your fingers, you remove it and change it. No, it's the tongue that does that. When it's performing its function, because it has filaments, they are like fur, but they are meaty. These filaments, they will retain part of that food. You get what I mean? So it always has to be cleaned every day. It has to be cleaned every day. To remove that food off, otherwise it also has diseases like oral thrush, and it can also develop cancer. So it needs to be kept in a proper way.
Okay. And then what about especially the jaws, the gums? Is there a mechanism of maintaining them healthy? Or they are also embedded in the brushing?
The brushing, it's particularly for the tooth and the what? The tongue. Then for the gums, I believe we would look at diseases that would affect it. For example, the gum disease that causes it to bleed. How do we get gum disease? First of all, not brushing well. If the food is retained on our teeth, it will spread. It will spread bacteria, or that bad bacteria will enter the gum. Remember, the gum is softer than the tooth. It is very sensitive. It's a very sensitive area. Sorry. It's a very sensitive area. So it needs to be cleaned with the teeth have to be cleaned so that to keep the gum also healthy. Any bad bacteria that can spread from our teeth to the gum will cause gum disease. And there are also habits that we need to stop. I've had people that bite their nails. You remember we collect a lot of dirt in between our nails. And when you bite, that dirt has bad bacteria. it will disorganize.
You only spit out the nail, you don't spit out the dirt.
You don't. And you actually carry the microorganisms, you can't see them, but they are there. We have habits that need to be stopped. I've talked about oral sex before. It's not good because people actually do it in this modern era, but it's not good for your health because there are organisms that need to stay down to our private areas, and they are comfortable there. They don't cause us diseases, but once they are shifted and they are put to an environment like a mouth that has sensitive parts, it will cause catastrophes like oral cancer and all that.
Okay.
Yeah.
So we have had, and Emma, I believe, has had. But before we wind up this conversation, what are your closing remarks and I wouldn't call it caution, but advice to other people there, especially those who are struggling with issues in their oral cavity?
I would strongly recommend anyone who is struggling with oral diseases to find a dentist, to seek for professional help. It's important to always find a proper solution to any problem that you're facing. Do not talk to people that are not professionals or that do not have enough knowledge to actually help you treat the disease or a condition that you're having. I personally am here. You can reach me out at Tafik International Hospital at Katweka Guje, and we will do anything to make sure that you're okay.
Okay. When you talked about seeking for information, you reminded me of people who sell all sorts of concoctions, and they advise you use battery acid, use this and this to a toothache, and then someone will tell you this particular medicine cures ulcers, toothache, what, and then there are also those who tell us you take it and you'll spit out the bacteria, and you'll even see it, and they're out there misleading very many people.
Now, to answer that question, I think those are people that are outspoken. They're very social with people. They know how to market their products. But it's something that I would not advise anyone to do. If you have a problem concerning oral health, seek for professional health. Someone from a hospital, a dentist, to help you out. Because it's not good to work on something just because maybe you want to save money, because the drug they're selling you on the street costs 20,000. A dentist asked you for 50,000. At the end of the day, you're treating something that will not cure, and you end up spending more money. Rather than sacrificing yourself, you save that money that the dentist has asked for, and you treat something in a proper way.
Okay. Well, Doctor, you talked about Tafik International Hospital, and just someone who would maybe choose Tafik as their dental clinic, just to give them a clear direction, because there's someone who doesn't know Kaguji. Kaguji is for the Kawaidas who have grown up from around that space. Now, I look at someone like whom was in transmission, who takes the other side of the road.
Okay, so for directions, you can search for it on Google Map.
Okay.
Our hospital is it's on Google Map.
Okay.
You can search for it. Tafik is TAFIK, International Healthy Center. But it's also on Ring Road. You know where Ring Road is? So the features that are next to it, we have a big hotel that is called Canada. You can reach out to it. Just after Canada is where you find Tafik International Hospital.
Okay. Well, thank you so much, Dr. Arnold, and to your viewer who started with us. We've come to the end of today's show, and we want to thank you so much. You started with us. Of course, it's a Tuesday. Tomorrow is a Wednesday, and it being a Wednesday, just to settle the hearts of the people who used to come for Family Hour on our Wednesday edition. Yeah, we altered the Family Hour Wednesday edition to have the ballot 2026, which runs every Wednesday from 9 p.m. to 11 p.m. Therefore, always come through and watch. Even tomorrow, the ballot 2026 is on, and of course, there's a lot that will be discussed with Mr. Baguma Richard, and of course the guests that will be part of the show. But once again, thank you so much for watching. Edrine Mukalazi is my name. I've worked with Emmanuel Alengai, the only man with a unique name around this space, but also Muhumuza and Bimanya, the only man who doesn't have a first name. Yeah, you know, the people I'm working with today are people with special features. And of course, the entire crew that we've worked together, we wish you a blessed night. Goodbye.
Family Hour, empowering families one episode at a time. Together, we build strong, healthy, and thriving families with our daily dose of inspiration and expert insights on topics that matter, like education and career growth.
A child may be a good entrepreneur, but you're forcing the child to make